actually a East Coaster originally. Came out to Los Angeles, went to undergraduate at University of California, Los Angeles. From there, UCLA med school, and then I actually commissioned into the military, and so the Army took me down to Texas, where I did my residency through Texas Tech, and then a joint replacement fellowship over at University of Southern California. I was actually a engineer in undergraduate. I was a bioengineer, so I kind of represented the culmination of my passions with science and physics and mathematics. As I got kind of toward the end of undergraduate, I wanted to do a little bit something more personal. Orthopedics was kind of a natural transition. There's a lot of biomechanics in that, but you have interface with patient care. I think that my military background has definitely fundamentally shaped me as a physician and as a person. I think that first and foremost, it gives me a certain sense of resilience. As a generalist in the military, have dealt with virtually every pathology, everything from battlefield injuries, from IED explosions, all the way to ankle sprains. It's a variety of patient types, everything from young active patients all the way to World War II veterans. That really gives me a good understanding of all the possible pathologies and management options out there. In order to optimize cardiovascular health and our own longevity, we really need to stay active, and I think that goes without saying. There's obviously a lot of apprehension around surgery. It's a big commitment. Ultimately, I'm very frank with patients. I tell them that this is a essentially lifelong relationship that we're fostering. They have a bad problem, but that we have very good solutions for that problem, and it's something that I follow along with them every step of the way until they're back to where they want to be. I think of and treat every patient as if they're my family member, and I always come back to the same question: is this, if this was my family member, is this the treatment that I think would be best for them? So when I hang up the coat for the day, what I always say is my hobbies are my daughter's hobbies. And so I have a 12-year-old and a 5-year-old, beach volleyball with the 12-year-old, and dance for the 5-year-old. Myself, I try to stay active. I think that activity and an active lifestyle is a quintessential part of a healthy life.